Hi everyone, I'm Dr. Rachel Johns, and I want to dispel a myth today, is that if I wear a mask, my oxygen level is going to go down. I don't believe this is so. In fact, surgeons wear masks for hours and hours on end, so we're going to go through a couple different masks today, and I'm going to show you with a pulse ox what happens to my oxygen levels when I wear different kinds of masks. So I'm going to start with this one first. I feel that this is probably the least severe. I'm going to hold this up the whole time so you guys can see it. This video is not edited. I have not practiced this before, so I really don't know what's going to happen. But I have a hypothesis that my oxygen levels will not go down significantly, and we're going to test that today. So I'm starting at 98%. It's not 100. It doesn't need to be 100. It's in the high 90s, so that's fine. So the first question we want to answer is, how much oxygen does the body need? And it depends on a lot of factors, actually. And the biggest dependent factor is, are your lungs even normal to begin with? Do you have any underlying lung disease? Do you have COPD? Were you a smoker? Maybe you have lung cancer. And so it depends a lot on how your lungs are functioning all the time. The biggest factor of how much oxygen or how much you feel it is the acuity and the severity of the drop or the change. And what do I mean by acuity is how fast is it changing. So I just put on a mask, and so that causes a very quick change. But if I'm going to go hiking up to 8,000 feet, which I'm not going to do in one day, then that change is much more gradual. And so then we want to talk about the severity. How severe is it? How big is the change? Is it going from 98% to 96%? Your body's not going to care. If you're going from 98% from 68%, your body's going to notice. Okay? Now I have started at 98% and now I'm down at 97%. Keep in mind, I've been talking the whole time, which also takes up more oxygen. So I'm going to switch to a homemade mask. This actually was made with flannel, so it's thicker. So my mom actually made this mask for my daughter, so I'm stealing it for this video. Don't tell her. So let's talk about some other things. What is this? This is a pulse oximeter, and what it does is it actually shines light through my fingertips, and it can measure the amount of oxygen that's in my bloodstream. So that's pretty cool. I am at sea level right now, so the amount of oxygen in the air that I'm breathing in is 21%. As you go up in altitude, that amount of oxygen in the air actually goes down. That's called a partial pressure of oxygen. And so when you're talking about a pulse ox, you always want to know where you are, what is the percentage of oxygen that you're inhaling for this to even start making any sense. So what makes your oxygen levels go down? So the first thing you think of is how much oxygen is in the air, like we just talked about. What makes those go down? Today we're talking about masks. Does wearing a mask make my oxygen level go down? Is it the altitude? We mentioned that before too. So I'm living at sea level, so the amount of oxygen that I'm inhaling is 21%. If I live in Denver, the mile-high city, which is called that because it's actually a mile above sea level, they're living at a lower pulse ox, about 5 to 6 points lower than I am at sea level. So I started at 98%. I'm still at 98, by the way, but they'll start this experiment at 92, 93%. And that's okay. They can start at that level because they live there all the time. Their body is used to it. So they're not going to have any symptoms of hypoxia, which is what it's called when you have low oxygen levels. Okay? So I don't think this is really doing anything. So I'm going to switch to the most obstructive mask that I have, which is an N95 mask. Okay, so I'll be talking and wearing this mask for a few minutes. So what are the other things that cause your oxygen levels to go down? The other things are maybe something's interfering with the oxygen that you breathe from actually getting into your bloodstream. So that is the function of your lungs, is that there's oxygen exchange with carbon dioxide. So there are things that happen in the lungs that actually prevent that oxygen exchange. Maybe you have pneumonia, doesn't necessarily have to be COVID, it could be anything. Maybe again you have COPD or emphysema, you were a smoker for a long time. Maybe you have lung cancer. Maybe you have a blood clot in your lungs that's preventing that oxygen exchange. The other thing that can lower your body's oxygen level is increased use of oxygen, like when you exercise. When your muscles are working all the time, they actually need more oxygen to work properly. Your body has a lot of compensation mechanisms to compensate for that, so that when you are exercising, your blood vessels dilate, you get more blood flow going, and then your muscles are getting the oxygen you need. You should not see your oxygen levels go down when you're exercising if everything else is normal. Okay, so again, my oxygen level is still 98%, and I've been wearing this mask and talking to you all the time. So what are the symptoms that we want to look out for if your oxygen levels actually do go down? The first sign is actually some confusion. You may not notice this. Confused people don't normally know that they're confused. You might have a headache, you might be short of breath, you might just have a cough. Okay, so be careful of that. You might notice your heart rate go up. You might notice that your lips and your fingernails turn blue. So those are the other symptoms that we want to look out for. We know that in COVID, people have what's called silent hypoxia, where their blood levels of oxygen are actually pretty low, but they don't feel that way. And we actually don't know why that is. So people come in and they're in the 80s, they feel fine, even though their lips are blue. We don't know. They should be feeling it, but they're not. So I've been talking to you all this time with several different masks on. Again, this is the most occlusive mask that I have, as N95 Mask, and my oxygen levels have been 98, 97% this whole time. So stick around for a bonus, and we'll do another experiment. Hi everybody, thanks for sticking around for the bonus level. So I pulled my treadmill over. I'm still wearing my N95 mask. I still have my pulse ox on. It's still 98%. And now I'm walking on a treadmill at 4 miles an hour. So let's review the things that cause your oxygen levels to go down. There's 3 things. One is the amount of oxygen that you are inhaling. I'm at sea level, it's 21%. But I have a mask. Is that getting in the way? That's what we're here to find out. My lungs are normal as far as I know, so there should not be anything in the way of my gas exchange. The oxygen should be entering my bloodstream normally, and the carbon dioxide should be exhaling normally. But we've added now one more level of difficulty in that I am exercising now. I'm walking at 4 miles an hour, and so my body is needing more oxygen to get oxygen to my leg muscles so they can work appropriately. Now, like I said before, your body has certain compensatory mechanisms that allow your body to get enough oxygen and for your oxygen levels not to go down. As you've noticed, I'm actually having a little bit of trouble breathing. I can't speak in a full sentence. And now my oxygen level it dipped down to 96 for a second, but it's now back up to 97%. So I think we can safely say that this myth has really been busted in that wearing a mask does not make your oxygen levels go down. I started at 98, 97, and now I'm at 96, 97. 1 percentage point, your body's not going to notice one bit. And so if you have any questions about masks, anything COVID related, put it below in the comment box, and I'm happy to answer any of your questions anytime. Bye everyone.